2.5. Asthisamhrt, Cissus quadrangularis L. Family, Vitacea, Asthisamhrt Cissus quadrangularis L. A perennial fleshy climber with quadrangular stem, found throughout the hotter parts of India alongside hedges. Other names: Sanskrit, Asthisamhrt, Vajravali, Bengali. Hadjota, English, bone setter. Gujarati, Hadsankal, Hindi, Hadjota, Kannada, Mangar Bali, Sundhu Bali, Malayalam, Puranta, Marathi, Kanval, Oriya, Hadabhangagacha. Part used: stem, whole plant. Major chemical constituents: amurine, amurone. Unsymmetric tetracyclic triterpenoids, Onaster 70Ne3A, 21E3-diol and Onaster 73-1,8 diol. Properties and therapeutic indications of stem Ayurveda. Guna, Laghu light, Ruksa dry. Sara, Rasa, Katupungent, Madhura sweet. Virya, Usna hot. Vipaka, Madhura sweet. Karma, Dipana digestive. Vadaklemahara pacifies. Vata and Kapha, therapeutic indications. Krimi worm infestation, Arshas hemorrhoids. Sandy, Sutta dislocation of joints. Important formulations, Laxaga Gulu AFI, Part 1, 5-8. Pharmacological studies. Immunomodulatory activity. Ethanolic extract of Cissus quadrangularis L 200 and 400 mg per kilogram, P.O. Evaluated for immunomodulatory activity on carbon clearance test, serum immunoglobulins. Delay type hypersensitivity DTH models. The extract produced increase in clearance of carbon particles from blood, increased immunoglobulins levels, dose-dependent increase in the DTH response to SRBC and stimulated the phagocytosis of killed C. albicans. Anti-stress activity. Ethanol extract of Cissus quadrangularis L in the dose of 500 mg showed significant increase in swimming time and anoxia tolerance time in stress-induced animals. The extract further showed decrease in blood glucose, cholesterol, triglyceride Tg, plasma cortisol and blood nitrogen levels. Clinical studies. Osteoporosis. Administration of Myavasti along with C. quadrangularis pulp powder 1 gram thrice daily with milk for 3 months in patients with osteoporosis showed improvement in pain, tenderness, general debility and BMD scores. In another study, patients with fracture in body of mandible treated with 80% alcoholic extract of C. quadrangularis in the dose of 1 TSFTDS 3.5 G thoroughly showed significant increase in alkaline phosphatase, serum calcium and tensile strength in terms of the biting force when compared to osmum sanctum, leaf powder and placebo-treated groups. Arthralgia. In healthy young exercise-trained men with chronic knee pain, administration of C. quadrangularis in the dose of 3,200 mg daily for 8 weeks significantly decreased the WOMAC scores, 25.4 plus or minus to 0.4 to 17.4 plus or minus to 0.1. References. 1. Quality Standards of Indian Medicinal Plants. Volume 2. New Delhi. Indian Council of Medical Research. Ministry of Health and Family Welfare. Government of India. 2005. pp 61-69. 2. The Ayurvedic Pharmacopoeia of India. Part 1 Volume 3. New Delhi. Department of Indian System of Medicine and Homeopathy. Ministry of Health and Family Welfare. Government of India. 2001. pp 21-22. 3. The Ayurvedic Formulary of India. Part 1. Second Revised English Edition. Department of Indian System of Medicine and Homeopathy. Ministry of Health and Family Welfare. Government of India. 2003. Bhrngaraja. Eclipta prostrata L. L. Family. Compositae. Bhrngaraja Eclipta prostrata L. L. Sin. Eclipta. Alba L. Hask. Herbaceous annual. Erect or prostrate. Much branched. Often rooting at nodes. Found as common weed of moist places throughout India ascending up to 1,700 meters. Other names. Sanskrit. Kewarya, Bhernga, Markava. Assamese. Bhrngaraja, Bengali. Bhrngaraja, Kesaria, Kesar. English. Trailing Eclipta plant. Gujarati. Bongro, Bongro. Malayalam. Kayoni, Nanuni. Marathi. Bhangra, Bhrngaraja, Nak, Urdu. Bhangra. Part used, whole plant. Major chemical constituents, wetalolactone and dimethylwetalolactone. Properties and therapeutic indications Ayurveda. Guna, Katupungent, Tikka bitter, Rasa, Ruksa dry, Tiksna sharp, Virya, Usna hot. Dipaka, Kadu pungent, Karma, Vadahara pacifies Vta, Kaphahara pacifies Kapha, Balya tonic. Therapeutic indications, Yakrotroga liver disorders, Kurmaroga worm infestation, so the swelling, Pondu pallor. Important formulations, 1, 826, Bhrngaraja Tela AFI, Part 1, 841, Bhrngaraja Tela AFI, Part 1, 842, Nili Brigadi Tela. Pharmacological studies. Cerebroprotective activity. Cerebroprotective and antioxidant activity of Eclipta alba is evaluated in global cerebral ischemia reperfusion injury induced in adult albino rats. Pretreatment with hydroalcoholic extract of Eclipta alba 250 and 500 mg per kilogram, day, PO for 10 days, significantly increased the levels of biochemical parameters viz. Superoxide dismutase SOD, glutathione peroxidase GPX, reduced glutathione GSH, catalase CAT, glutahinestranceferase GST, glutathione reductase GR and decreased the malondialdehyde MD in brain. Reduced the edema and cerebral infarct size compared to the ischemic control group. The extract at high dose markedly reduced ischemia-induced neuronal loss of the brain. Cytotoxicity activity. In vitro study on cytotoxicity potential of A alba showed the alcoholic extract of Eclipta alba found to be effective in most of cancer cell lines, but significantly induced apoptosis in human breast cancer cell lines by disrupting mitochondrial membrane potential and damage of DNA. Further, the extract inhibited migration in both MCF7 and MDAM beta-3-1 cells in a dose-dependent manner. The alcoholic extract also demonstrated antioxidant activity, antidepressant activity, oral administration of ethanolic extract of E. alba leaves in the dose of 200 and 400 mg per kilogram body weight for 7 and 14 consecutive days demonstrated significant antidepressant-like effect on immobility period of rats in both the models of depression i.e. forced swimming test FST and total suspension test TST by reduction in immobility times of mice. The efficacy of extract at 200 mg per kilogram dose was found to be comparable to that of standard controls. Fluoxetine 20 mg per kilogram and imipramine 15 mg per kilogram. Clinical study. Hypertension. Administration of Eclipta alba leaf powder 3 grams per day for a period of 60 days in mild hypertensive male subjects showed marked improvement in mean arterial pressure, total cholesterol, low-density lipoprotein fraction, triglycerides, very low-density lipoprotein fraction and plasma lipid peroxides, increase in urine volume, urine sodium, serum vitamin C and serum tocopherols. References. 1. Quality Standards of Indian Medicinal Plants, Volume 9, New Delhi, Indian Council of Medical Research, Ministry of Health and Family Welfare, Government of India, 2011, pp 138-151, 2, The Ayurvedic Pharmacopoeia of India, Part 1 Volume 2, New Delhi, Department of Indian System of Medicine and Homeopathy, Ministry of Health and Family Welfare, Government of India, 1999, pp 21-24. Brahmi, Bacopa mani Ariel, Wetst, Family, Plantagenaceae, Brahmi Bacopa mani Ariel, WETTST. A succulent creeping marshy herb with pale blue or pinkish white flowers occurs commonly near banks of fresh water streams and ponds and other damp places throughout plain districts in India ascending up to an altitude 1,350 meters. Other names, Sanskrit, Sarasvati, Kapotavank, Assamese, Brahmi, English, thyme-leaved Graciola, Gujarati, near Brahmi, Balmanavari, Hindi, Brahmi, Mandukaparni, Malayalam, Balmi, Marathi, Jalnam, Brahmi, Birami, part used, whole plant. Major chemical constituents, Bacicide A1, properties and therapeutic indications Ayurveda 2, Guna, Laghu light, Sara, Rasa, Tikta bitter, Kawaya astringent, Madhura sweet, Virya, Sita cold, Vipaka, Madhura sweet, Karma, Prajastapana sustained pregnancy, Visahara antidote, Mohahara alleviates delirium. Therapeutic indications, Kusta disorders of skin, Shvara fever, Sofa swelling, Pondu pallor. Important formulations, Saraspatrita AFI, Part 1, 136, Brahmigrita AFI, Part 1, 632, Ratnagiri Rasa AFI, Part 1, 2032, Sarasvata Kura AFI, Part 2, 719, Brahmi Vawi AFI, Part 2, 1645, Bhrngaraja AFI, Part 2. Pharmacological studies, anti-Parkinsonian activity, anti-Parkinsonian effect of a Bacopa monnieri evaluated by using a genetic model system Canorhabditis elegans in a transgenic model and a pharmacological model. The study showed that B. monnieri reduced alpha-synuclein aggregation, prevents dopaminergic neurodegeneration and restores the lipid content in nematodes, thereby proving its potential as a possible drug in the disease Parkinson's. Nootropic activity in colchicine-induced dementia model. Treatment with Bacopa monnieri at 50 mg per kilogram BW reversed memory impairment, attenuated oxidative damage, restored the activities of antioxidant enzymes and membrane-bound enzymes NA plus K plus ATPase, and AKE. In another study, on ethylcholinaziradinylamine AF6 for A-induced Alzheimer's disease model rats, alcoholic extract of Bacopa monnieri at 20, 40 and 80 mg per kilogram BW for 2 weeks improved the escape latency time in Morris water maze test. Immunomodulatory activity. In vitro studies of Bacopa monnieri showed significant secretion of mediators like nitric oxide and ON superoxides on isolated murine peritoneal macrophages at the doses of 416 micrograms per milliliter and 208 micrograms per milliliter. It also showed a significant increase in the phagocytic index at the doses of 100 and 200 mg per kilogram, enhanced total leukocytes count at 50 mg per kilogram and 100 mg per kilogram in cyclophosphamide-induced myelosuppression in mice. Antidepressant activity. Antidepressant activity evaluated in albino mice showed that Brahmi exhibited significant decrease in duration of immobility in forced swimming test and reduced shock-induced depression. Clinical study. Dementia. Treatment with a polyherbal formulation containing B. monnieri 500 mg 2 times a day for 12 months in senile dementia of Alzheimer's type SDAT patients showed significant improvement in the functional activity questionnaire and depression. Reduced level of inflammation and oxidative stress. References. 1. Quality Standards of Indian Medicinal Plants. Volume 8. New Delhi. Indian Council of Medical Research. Ministry of Health and Family Welfare. Government of India. 2010, pp 86-96. 2. The Ayurvedic Pharmacopoeia of India. Part 1 Volume 2. New Delhi. Department of India. Stem of Medicine and Homeopathy. Ministry of Health and Family Welfare. Government of India. 99, pp 25-26.